So, are there changes or maybe recommendations to conversations that providers at different levels should be having? Because obviously, when you get to the point,
Mhm.
I mean, outside of the attempt, but even if there was an attempt, you'd still have this tumor and whatever would follow with that. What should providers be doing before we get to this dire point to
Mhm.
maybe help increase the likelihood of catching this at a more opportune
Yeah.
spot?
Yeah, so that was our main thinking point. We want the providers to be aware of their patient symptoms. I want all the providers should be asking to their patient, what is not usual to you? What is not normal to you? Such simple questions. We could have find like maybe this patient, if he would go to the provider and the provider would ask, what is not usual with you? He would tell that I sweat when I lift heavy weight. That was normal to him. But if you ask question, because you don't know the symptoms of the disease and might feel some palpitation or you see your face red, flushed, maybe the family members noticed you, but you couldn't realize. So I would say these kind of symptoms, they get unnoticed and they get delay the diagnosis of like such a disease that has a huge bad like complications and comorbidities.
Hmm. Yeah, that question of what is normal to you, I think, is kind of like a really important linchpin to misdiagnosis, because I feel like even people who deal with chronic stress, for instance, right, what's normal to them is not actually quote unquote normal, right? Like I think people sometimes they live with certain symptoms and they're just like, yeah, this is how it is. Doesn't
Yeah.
everybody do that? Until one
Mhm.
day your doctor's like, nope,
Yeah.
everybody doesn't experience that. So yeah, I'm wondering, just from a patient education perspective, are there any other places that you think that we kind of miss communicating with patients? Any other opportunities to help kind of diagnose things sooner, as far as patient education and raising awareness in patient populations?
So definitely, I agree with you. Patient education awareness, that is most important. I feel like pheochromocytoma, the symptoms and the presentation is not that common. So we don't have the awareness. That would be great if we can create the awareness. I think social media would be the great, because in that case it's easier to spread the symptoms awareness strong, so that everybody knows. If you don't know, like, you will not see anything if your mind doesn't know. So if we can create that awareness, I think in future we'll see the diagnosis of pheochromocytoma is going higher and higher, although we have it maybe undiagnosed.
Mhm. What is the general impact of this diagnosis on populations? Are there any populations that kind of get this diagnosis more often than others? And overall, I don't know what the main population was like in America, for instance. Like, what is the overall impact when you say rare? Like, what percentage is that
Yeah.
generally?
Yeah. So unless they have complication, they don't present to the doctor. But there were cases. Out of three cases, one of the cases was a cancer patient. Cancer patient was getting treatment for chemotherapy, oncology. The patient has endometrial cancer, and when they treat the cancer, they definitely do the CAT scan of the whole body. This is called pan CT to find out the metastasis or the disease status. At that point, patient was found to have an incidental nodule in the adrenal gland, and that made them work up like so. I'm just want to tell that patient didn't have like typical symptoms of pheochromocytoma. Patient had generalized weight loss that can be from the secondary to her primary cancer, endometrial cancer, or the chemotherapy. But unless this nodule was found on the screening for the cancer, we will not know this case. So I think this is interesting.